In Sevilia's apartment, there was nothing that could implicate the lawyer or clarify any fact related to the attacks or his possible romantic relationship with the late Maria Valdivia. No weapons or documents were found, everything had been carefully cleaned, and the owner of the residence seemed to have evaporated. After Sevilia's vacation period ended, as expected, the lawyer did not return, and this situation, combined with the lack of information from Interpol and the Colombian police, increased insecurity and anxiety among everyone in the Valdivia clan. Faced with this situation, Ana invited a psychiatrist, Dr. Rubens Lamarca, the most important Colombian specialist, with the aim of monitoring Carlos more closely, who, due to his amnesia, seemed exaggeratedly distressed by the turn of the most recent events. To evaluate the patient, Dr. Lamarca held several meetings with close family members, with Ana, with the police officers and doctors who treated Carlos after the attack on him. On the phone with Ana, Inspector Esteban was intrigued by Ana's excessive nervousness when she invited him to the interview with Lamarca. The last and most important meeting held by the psychiatrist was with the neurosurgeon at the Mocoa Central Hospital, from whom he heard a detailed account of the businessman's current clinical condition. 2 weeks would pass before Dr. Lamarca defined the approach which, according to the doctor, would be the most appropriate given Carlos' medical condition and moment in life. According to the psychiatrist, the resource that could mitigate Carlos' anxiety condition would be drug-induced regressive hypnosis. In front of the Valdivia cousins and their fiancés, the psychiatrist detailed the procedure and asked if everyone would agree if it started in the afternoon of the same day, avoiding prolonging Carlos' anxiety condition. The doctor explained that the procedure would result in a dreamlike automatism that would be obtained through an intramuscular injection of a solution mixture of morphine hydrochloride and scopolamine hydrobromide, until a state of semi-unconsciousness was achieved. Carlos was in favor and was followed by everyone else in the same position. In the middle of the afternoon, the psychiatrist and a nurse began the procedures accompanied by Ana, Carolina, and Andre. The curtains were drawn, and, in the air-conditioned environment, Carlos was placed in a reclining chair. Once settled in, the businessman received mild sedation and the hypnotizing solution was injected into a vial of serum. In a few moments, Carlos seemed asleep, and the scene resembled something theatrical. Lamarca approached Carlos and asked his name. Carlos, looking upset, said his full name. Afterwards, Lamarca asked Carlos to go back to the day he was shot. Carlos, appearing to be in pain, described how he woke up, the coffee he had drunk, what he had read in the daily newspapers. Then he described the journey to one of his farms and everything he had done there. In the afternoon, the businessman would have gone to the center of Cali and was briefly at the VEMP headquarters. At around 5 p.m., he described his return to the condominium, where some time later, he had dinner in the company of Maria. At that moment, Carlos broke out in a cold sweat. Lamarca asked what he saw. Then, with tremors, Carlos stated that there was a masked man pointing a gun at him and Maria.